prevents the egg from being fertilised by the sperm by preventing the sperm from surviving inside a woman's body, as copper is toxic to sperm, stopping a fertilised egg implanting in the womb. Pros: the IUD can be fitted as a method of emergency contraception. It does not interrupt sex. It is 99% effective. Once you have had it fitted, it prevents pregnancy for between 5 and 10 years. It protects you from pregnancy immediately. Your fertility will return to normal after the IUD has been removed. It can be used by women who cannot use contraception that contains hormones, such as the combined pill, the progesterone-only pill, vaginal ring, IUS, and contraceptive patch. The IUD is not affected by vomiting, diarrhea, or other medicines like other methods of contraception. Cons: does not protect against sexually transmitted infections. Periods may be heavier, more painful, or last longer. There is a small risk of getting an infection after the IUD is inserted. There is a small risk of the IUD being pushed out or the IUD becoming displaced. There is a very small risk of perforation of the uterus. If you do become pregnant whilst you are using the IUD, there is a small risk of an ectopic pregnancy.
The IUS is a small T-shaped plastic device which contains the hormone progesterone. This controls your fertility. The device is put into the uterus through the vagina by a specially trained doctor or nurse. The IUS works in 3 ways to prevent the egg being fertilised by sperm. It interrupts this process by thickening the mucus around the cervix, making the lining of the womb thinner, and it can also stop ovulation in some people. Pros: the IUS is 99% effective and it does not interrupt sex. It can prevent pregnancy for 3 to 5 years depending on the brand. Your periods may become lighter, shorter, or they may stop completely. Your fertility will return to normal once it has been removed. There is no evidence that it causes additional weight gain. It's a great option for women who can't use contraception that contains estrogen, and it is not affected by vomiting or diarrhea or other medicines like other methods of contraception. Cons: it does not protect against STIs. It may cause some irregular bleeding at first. It can cause temporary side effects such as skin problems, headaches, or breast tenderness. It can cause small fluid-filled cysts on your ovaries, but these tend to be symptomless and they usually disappear without treatment. There's a very small chance of getting an infection after insertion. There's also a very small chance of the IUS being pushed out or displaced, and a very small risk of tearing of the uterus. It's also worth remembering if you do become pregnant while you are using the IUS, there is a small risk of ectopic pregnancy, but if you are concerned about this, consult a nurse. Who won the battle? You decide. Visit contraceptionchoices.org and select what's right for me to calculate your top 3 contraceptive methods, or you can speak to us directly and confidentially on 0808 168 1238.